Hi, this is Michael Ty again of Advanced Benefit Center. Well, you probably looked at what's available through the exchange, covered California, and may now be looking at broader options. While the exchange only offers the limited networks of Anthem and Blue Shield, buying directly from these carriers offers you a choice as to whether you want to purchase plans that offer their full or limited networks. You'll pay less for the limited networks, and that usually means the loss of some of the more prestigious healthcare providers. Obviously, if your providers can be found on the limited networks, that should be considered. Additionally, while the carriers probably have identical plans at identical premiums as those in the exchange, you will have other plan designs in addition to those that might better suit your needs. So both Anthem and Blue Shield HMO networks are almost identical. Please note that not only has there been dramatic changes made to comply with the law, but carriers have been dramatically changing also their compensation to providers. Consequently, you can't make any assumptions about your doctor or hospital being contracted with carriers that they have in the past. We're finding out that some hospitals are signing contracts for the bronze tier plans, but not the gold or platinum. Some carriers have actually reduced their PPO network by 50%. So you really shouldn't make any decisions based on past information. You can search for your doctors and or your hospitals on the carrier's website, or call the providers directly. A carrier's formulary or their list of drugs can vary. So consider looking at the formulary if you are taking any maintenance medication. There's been a leveling of premiums with HMO and PPO plans, so we can't really make any blanket recommendations anymore about which direction you would want to take. Kaiser can be a great option, both from the standpoint of premium as well as having one of the most efficient healthcare delivery systems around, and about the highest patient satisfaction levels of any medical group. As you know, all carriers must now guarantee coverage to anyone applying without consideration of pre-existing conditions. We've recommended Anthem, Blue Cross, Blue Shield, and Kaiser to individuals for decades, and will continue to do so. Allow me to provide some guidelines for selecting the most appropriate plan for yourself. You must decide what you want your plan to cover. For some, paying the first several $1,000s of claims is preferable to paying much higher premiums every month. For others, the additional premium is worth the comfort of having some of their smaller claims paid. Plans that have a deductible normally cover office visits and prescriptions without having to satisfy the deductible. You would only pay that deductible when something serious happens and you're facing hospitalization, surgery, or high-end diagnostic testing. Regardless of which plan you choose, there's a maximum out-of-pocket that you'll pay for all your medical costs for the year. That normally includes any deductible and co-insurance, the 30% or 20% that you'd pay, as well as the co-payments of those flat dollar amounts. As in the past, we are committed to making your plans work, so call us if and when you experience difficulty with any aspect of your health plan or health care. Now you'll return to the shopping flowchart where you can click on the link to Anthem, Blue Shield, or Kaiser to investigate their offerings. Once you've narrowed down your options, feel free to call us with any questions or email. We look forward to hearing from you.